Good day to you all. Today's video is going to be about cannabis-infused suppositories. Cannabis-infused suppositories have gained attention for their potential therapeutic effects, especially for female health conditions and oncological and palliative care, means cancer and end-of-life care. A suppository is a small cylindrical or round-shaped object that contains medicine. It is inserted into a body orifice, most commonly the rectum and the vagina, sometimes the urethra and other orifices. This method allows for more efficient absorption of most cannabinoids, particularly when oral consumption is contraindicated or inappropriate. For example, if someone is in a coma and you want to medicate them, a suppository is a great way to do that because they can't swallow. As I said previously, suppositories are designed to be inserted into the vagina or rectum, where they are absorbed directly into the bloodstream. Rectal suppositories do not yield the effects of THC, meaning in the 1980s, scientists observed the absence of detectable THC levels in blood plasma following rectal administration. In 1991, a preclinical study using monkeys, delta-9 THC was connected to various ester groups. Hemisuccinate was one of the ester groups. Each suppository contained a 10 milligram dose of delta-9 THC. Other studies confirm this, so THC requires an attached hemisuccinate ester to be absorbed via rectal suppositories. Hemisuccinate ester group, that's a chemical structure that is attached to the THC molecule that makes it water soluble. THC with the ester group attached is converted to THC inside the body. Patients using THC-based vaginal suppositories without hemisuccinate report they experience the effects of THC, including impairment. The vaginal mucosa has a rich blood supply, allowing cannabis components to be absorbed directly into the bloodstream. It is important to note that comprehensive pharmacodynamic and pharmacokinetic studies of cannabis-infused suppositories have not yet been done. Now, let's look at the potential benefits of cannabis-infused suppositories. The first, pain relief. People using cannabis-infused vaginal suppositories report relief from menstrual cramps, pelvic pain, or conditions like endometriosis and pain with intercourse. Another benefit is muscle relaxation or spasm relief. Cannabis contains compounds with muscle relaxant properties that may benefit individuals experiencing pelvic muscular spasms or tension, including menstrual cramps, pain with intercourse. CBD and CBG are two, but not necessarily the only phytocannabinoids that yield these benefits. Another benefit is anti-inflammation. Cannabinoids, such as CBD, CBG, have anti-inflammatory properties. This could benefit inflammation-related conditions like arthritic pain, back pain, and endometriosis. Inserting vaginal suppositories avoids first-pass effects. The first-pass effect is that the subproduct does not go through the liver initially. When it goes through the liver first, it will reduce the concentration of the active ingredient that will reach the circulation and its intended targets. So drugs that are absorbed via the gastrointestinal tract, meaning swallowed and they go through the stomach, will pass through the liver. The liver then acts as a filter and only part of the drug or substance is circulated systemically. And because of that action, suppositories don't cause nausea or vomiting due to gastric irritation because they're not being delivered initially through the gastric organ. A very important benefit is that suppositories can be given to patients who are unconscious, for example, during end-of-life or post-op care for pain relief and other conditions. Suppositories offer a direct method of administration affecting the vagina or rectum, such as menstrual difficulties, digestive issues, or tumors in these areas. So what are the types of suppositories? There's a CBD dominant, meaning these contain primarily CBD or other non-impairing cannabinoids with little to no THC. Then we have THC dominant. These suppositories contain higher levels of THC and may cause impairment. Then you have the combination of THC and CBD, CBD, CBG, CBD, CBG, CBC. All different combinations of phytocannabinoids can be included in the suppositories. So it makes suppositories a very versatile route of administration. Dosage can vary. You start with a low dose and increase. The right amount depends on the individual. What is a high dose for patient A can be a low dose for patient B, or vice versa. Monitor how your body responds before considering higher doses. The ideal dose is found by starting low and increasing the dose as you go along. It is advisable to consult with a cannabis clinician or healthcare professional before trying cannabis suppositories or cannabis products in general for that matter, especially if you have pre-existing health conditions or are taking other medications. Please be sure you obtain products from reputable sources that adhere to quality and safety standards. Do not use any cannabis products if you haven't read the product's certificate of analysis or if there isn't one available. There should be a QR code on the product label or a link to the certificate of analysis on the producer's website. The certificate of analysis is a report of the various testing that was done on the cannabis product. Did it contain mold? Did it contain bacteria? Does it contain what it should contain? Does it contain CBD, CBG, or whatever you're looking for? We at Victory Rejuvenation Center can advise you. Thank you for watching this video. Please like, share, and subscribe. It will be available on all of our platforms. This information is contained in all of our newsletters. So when you go to our website, you can sign up to receive newsletters and enjoy them on your own. Thank you for watching. See you next time.